Is COVID slowing down research? So I do have updates on that. So because retrieving a brain can actually put healthcare workers at risk, we are de-emphasizing new brain donation right now until we know more about retrieving these brains. So we're taking brains that are being retrieved by medical examiners in their normal course, but we aren't doing the same type of outreach right now until we know that the workers are safe and they have the proper PPE. So in that sense, we're going to get fewer brains over the next few months. But the good news is, I spoke to Dr. McKee the other day, the doctors are actually using this time very well to write more papers. You know, they're either in the lab doing the work or they're at home figuring out and analyzing the data. And so now they're writing and analyzing. And so I look forward to more papers coming out with that. So I think another good question is, how close are we to being able to diagnose CTE in the living? So Dr. Cantu, I know you're involved with that study, you mentioned it. Can you give a reasonable expectation for when we do say diagnosing CTE living, what that means and how far away that is?
Well, Chris, I don't want to put any damper on anything because I hope I'm wrong. But back in 2008, we thought we were maybe 5 years away, and there was one ligand, the T807 PET ligand, which showed great promise, continues to show promise, but as yet is not sensitive enough and specific enough to diagnose CTE in the living. So I think it's probably more than 5 years off. Hopefully I'm wrong. I always like to err on the side of being optimistic, but I think we need to be realistic as well. We've been looking for a specific diagnostic test for quite a while. And as Jim has said already, we've been looking for the same kinds of things for Alzheimer's disease a lot longer. And although we have tests that give us promise, we still can't make the diagnosis with certainty in the living.
Thank you. And there's a question around symptoms. The first one, I'll throw it to you, Dr. Castle. Do you consider paranoia to be a part of the CTE symptomatology?
Yeah, that could certainly be part of it. People do have delusions. They'll often think that, you know, people have been in their rooms stealing their things, or there's other people watching them from outside. So it's certainly not 100% of the time that people have that symptom, but that is something that we do hear, yes.
And, you know, something we didn't touch on, but I think can be very helpful to people is, what's the opinion on CTE in a relationship with sleep, and how do we handle that? Maybe Dr. Cantu, do you want to start? And we'll throw it to Jim if he has more.
Well, certainly if you're having trouble sleeping, whether it's post-concussion syndrome, whether it's CTE, or whether it's Alzheimer's disease or frontotemporal dementia, it can make the symptoms worse. So it's very much worthwhile to direct one's attention. The innocuous things you can do are things like getting exercise and proper diet, using melatonin, and then it becomes an individual call, and we not often go to sleep medications, but occasionally that will be needed, but hopefully not frequently.
And another question around that is the behavioral issues. You know, I've seen a few comments around, and we've heard this from families over the years, the impulse control issues, the quick bursts of aggression or verbal abuse that sort of then disappear. Is that something that you hear from your patients, Dr. Castle? And then how do you treat something like that, both possibly medically or behaviorally?
Oh, yeah, that's a very common complaint that people give, is these rage outbursts, irritability. If it appears that it's something that could be controlled with counseling or behavioral modification, we'll always try that first. But you know, again, I've had a lot of success with using some of the antidepressants. In particular, I use sertraline as a first-line medicine. I find that that's extremely helpful for irritability. I would say the majority of my patients, you know, we end up having to use some type of medicine to help some of these symptoms. There's a lot of things that you really just can't control entirely with behavioral therapy. So we do have good treatments for that. And I would urge people who are suffering from these problems to see somebody and see if you can get treated.
While we're talking about treatments, Chris, I want to briefly mention about the CBD that Leonard was bringing up. Unfortunately, the research isn't there right now to say that this is definitely helpful with CTE, but clearly there are anti-inflammatory properties. Clearly there are anti-anxiety issues that are seem to be helped by CBD. So if somebody is using CBD and they do feel that it seems to help them, I would be very supportive in them taking CBD. I think as long as somebody believes in something and they think that it's helping them, I'm a supporter of it, unless there's a significant downside or a contraindication for it.
Thank you for that, Bob. So there's why I want to do a quick answer myself because it's quick, and I know my buddy Ron asked it. How do you distinguish between normal anger issues or symptoms versus other disorders? And the answer is, it's a difficult differential diagnosis that really only experts can make. And so if you have these symptoms that are affecting your lives, the point is go get a doctor like these two who will help you figure it out and treat that symptom. And again, if you can't find it, reach out to our helpline. We'll help you find that doctor. The key here is that we want you to engage with your medical community. If you have concerns, if you have symptoms that could or are CT or not, see your doctor. That's really the goal. So I love this question. It's sort of a fun one. I'll read it word for word because it's not me saying it. The football industry continues to market the idea of uncertainty around causality of head impacts and CTE, and a lot of people still wonder if there's quote unquote proof. So maybe Bob, you've been part of the studies, and I'll get Jim's opinion from his work. Do you think how strongly is the evidence on causation?
I think the evidence is extremely strong about causative association. In other words, the most consistent thing that we find with individuals with CTE is a history of repetitive head trauma. And the higher that amount of that head trauma, the greater the likelihood for CTE. If you played football 14 and a half years, you're 10 times more likely to have CTE than somebody who played less than 5 years. If you played all the way through to the NFL level and played 10, 15 years, that group that we've looked at has a very high incidence of CTE. If you played through college, it's still high, but lesser if you wind up getting symptoms. And of course, when I say that, we again don't know the incidence and prevalence, but basically the greater exposure, the greater your chance for having CTE in all of the hundreds and hundreds of brains, which now are more than 800 that have been studied at BU alone.
Dr. Castle, how about you? What do you think about causation?
Yeah, there's no question in my mind that there's a causative role for multiple head injuries, subconcussive and concussive injuries. I don't think we know what the dose limit is that you have to get CTE. But in my mind, there's absolutely no question at all that there's a relationship. And I don't, for example, I don't let my own children play football at all because of this.
Oh, thank you. Interesting. And it's interesting you mentioned the dose limit. We don't know the dose limit because that's also it's actually a talking point from a lot of critics of this work. And whenever I hear that, I say, well, do you know how many cigarettes it takes to cause lung cancer? The answer is no, of course not. It's different for everybody. We just know general risks for the group, and that's all we're ever going to know for football too, or for any of these other sports. So don't look at just because we don't know everything as that we know nothing. But it is a good question for you, Dr. Cantu. You alluded to it, but let's be specific. Somebody asked, I was a football player, I was also a catcher in baseball. How do different exposures interact?
Yeah, that's a great question, Chris, and you would think that we would have the answer to that, but what is published in the literature thus far, the biggest study is one by Beneke, who is a neuropathologist from Mayo Clinic, now at the University of Texas. He looked at the incidence in his brain bank of CTE, which was the Mayo Clinic brain bank. And he found that the one sport that was associated with CTE was football beyond high school, in his experience, not through high school, but beyond it. What he didn't find was an association that if you played another contact collision sport in addition to football, that you had a heightened risk. We still think that's probably the case, it just makes intuitive good sense, and maybe he couldn't find it because he didn't have enough cases in his cohort that he was studying. But as of today, there are not published statistics out there that say that if you play 2 or 3 sports, you're at greater risk than just playing football.
Thank you. And let's revisit the idea of the family unit here, because this question's come up a few times on how family members can best interact with patients. And when we think about this, there's patients that come from different angles on this. So Jim, why don't we talk about the patient who doesn't believe there's anything wrong, but the family knows? How do you recommend spouses or children, talk to a loved one who's maybe in denial that they're different or they might have symptoms related to CTE?
Yeah, that's a great question, and that is a very tricky issue to deal with. There's a lot of brain diseases where people don't have good insight into the fact that they're having a problem. Some of those are even personality issues. I think most of us can relate to that, where we know someone who's got a terrible personality problem, but they think they're fine. They think everyone else is the issue when it's really them. And with a lot of these neurodegenerative problems, the person who suffers from the disease doesn't realize that they have a problem. And I really don't know of any fabulous way to fix that. There are some things we can't fix. I think you just have to do the best you can. I wouldn't pick fights with someone. I always tell people, look, don't coach your loved one, just help them. So don't try to explain things to them. Just try to help them. The example I give is if somebody says to you, well, where do I put this plate? The thing you don't want to do is say, well, come on now, think about it. We've talked about this, think about it. You just want to take the plate, help them, show them where it needs to go. Only if there's a real safety issue should you get involved. For example, if someone insists that they're a safe driver, well, that is something you have to deal with. But a lot of times you don't necessarily have to start an argument over it if they think that they're fine and they don't realize that there's a problem.
Yeah, thank you. Bob, any other thing to add there, and including?
The only thing I would add, Chris, Jim really covered that beautifully, but I want to cover the flip of what he's talking about. The high school kid who comes to see you that has obvious behavior and or mood issues, may or may not have some ADD issues, and he's absolutely convinced in his own mind that he's got CTE, when the overwhelming likelihood is he does not, especially with that limited amount of exposure. Can you say with 100% certainty he doesn't know? But you can say overwhelming, the likelihood is no. And these people we counsel and counsel and counsel and keep trying to get through to, and obviously put them in the hands of counselors as well, and neuropsychologists, et cetera. Sometimes we're successful in alleviating their concerns, sometimes not. Sometimes we even have to go to anti-anxiety medicine with these people, but it's a difficult population when they're convinced in their own mind that they have CTE, and you have to try to unconvince them.
Yeah, I like to say CT is not destiny. If you have the exposure, it doesn't mean you're going to get it. And if you get it, it doesn't mean your life's going to turn horrible. And so, that being said, you shouldn't expose yourself to getting hit in the head. That's my recommendation. I don't do it anymore. I used to do it a lot. Other sports, just quickly to answer, somebody asked about, I'm a hockey player, I'm this. We have great data on football because 2/3 of our brain bank is football players. We have shown that CT exists in just about every contact sport, including mixed martial arts and other things. We just don't know how risky it is. Most of our NHL players have it, but most of our youth or college hockey players do not. It seems to be an exposure issue, and the more hits, the more risk. But football is where we're most comfortable because our team, Dr. McKee's team, has really looked at nearly 600 football brains, and everywhere else we have maybe 50 at the most. So that's really interesting. So what about genetic testing? Bob, what do you know about that?
Well, we don't have a genetic test for CTE. We have 2 papers that the Boston group has published showing that certain genes seem to either be protective or seem to be associated with a higher risk, but we're not anywhere near with a definitive single gene or cluster of genes that can say that they have CTE or not. Certainly the one that's been studied the most is the ApoE4 allele that is associated with Alzheimer's disease, as I'm sure Jim can say, but the overwhelming majority of cases of CTE in the brain bank do not have the ApoE4 allele. Thank
you. And I do want to acknowledge another question that was answered. I can do this quickly. Is we are talking about women and why not? And the answer is there's 2 women in history have been diagnosed with CTE. When one was the victim of physical abuse, one had a developmental disorder and banged her head a lot. We have not yet seen it in an athlete, but that doesn't mean it's not there. 98% of the brains that are donated to our brain bank are men, partially because historically men's sports have had more brain trauma exposure and football is almost exclusively men. That being said, we've been working with people like Michelle Akers and Brad Chastain from the women's national soccer team, who have been recruiting people to donate their brains. And we hope to get a better window into this as the generations of female athletes who were, with Title IX were allowed to play more sports age, and we'll get a better window into what's going on. But we just don't have the data right now. So we apologize. But what about, okay, this one's for who wants to take this, a good question for our military folks. What's the interaction, or what do we understand about CTE and PTSD? What's different? What's the same? How can they look the same? And how can we diagnose it?
Well, just like, I'll let Jim elaborate on this too, just like we cannot, based on the symptoms alone, distinguish between Alzheimer's disease and CTE. There's too much overlap. We also can't distinguish between the two with post-traumatic stress disorder either, based on the symptoms alone, because again, there's so much overlap. When I showed that symptom checklist for CTE overlaps greatly with post-traumatic stress disorder. With post-traumatic stress, there should be a single incident that then set off this cascade of symptoms. And so that's more how we come up with that diagnosis.
Jim, do you want to add to that?
Yeah, no, I would absolutely agree with that. It really is an art to try to differentiate between those types of syndromes. There's so many similar symptoms that the person has. And, one thing I would say, though, is for the majority of cases that I've seen, the PTSD, there's more of a temporal relationship with the event that occurred. It tends to start right after that event, may get better over time, whereas CTE should be the exact opposite. There's kind of a lag between when the event occurred and then when the onset of symptoms, and the symptoms should theoretically be getting worse over time, not better. So you try to just make the best judgment you can, but there's really no specific guideline to say, well, this is all PTSD, this is all CTE.
Yeah, what's very special about our brain bank actually is that Dr. McKee is also one of the leaders in the VA's PTSD brain bank, and that didn't exist. The PTSD brain bank was actually started after our brain bank, so they know less about the pathology of CTE than they do of PTSD than they do of CTE, which goes along with the question of to me and you, Jim, as college football players, do we feel affected? Yeah, I feel affected. That's why I say the wrong thing sometimes. But legitimately, those who know my story, I suffered from PCS. Dr. Cantu diagnosed me, but I'm also at risk, unknown risk to CT myself from my football and professional wrestling career and soccer, 8 years of soccer too. So I'm in this boat with you. Jim, you don't have to answer that question. You don't want to. You seem fine to me. What do you think?
Yeah, I hope I'm fine, although I do lose sleep at night sometimes thinking about it. But as far as I know, I'm fine.
That's good to hear. Connection between CT and epilepsy. What do you guys know? You guys have any data on that?
I don't think there's a connection between the diagnosis of epilepsy and CTE. There are a couple of publications that showed some individuals with temporal epilepsy may have had CTE-like findings in their brain, but whether that was due to the brain trauma itself that was sustained with those grand mal seizures or not is just not clear.
Yeah, I think there is an association between TBI and epilepsy, but we don't know the specific relationship between CT and epilepsy. And if there is a relationship, it might just be because CT has a relationship with TBI, and therefore a person with CT would have a higher risk of epilepsy, but we don't really have data on that right now. There's also questions about research. So there is not a lot of research going on CT right now, but there is some. And so we'll follow up with a link to the list that we have. If you know of studies that are on that list, please, or studies that you're involved with, please let us know. We'll add them to the list. But we'll keep you informed of any research. Let me see. I see a few more questions. I know the doc's got to go, so we'll take one or two more. Let's see. Oh, training doctors. How are we doing on training doctors on how to get better at treating CTE?
Jim, I'll let you lead off.
Yeah, the answer to that is I think we're doing a fairly decent job at it. You know, we have a relationship with the University of Chicago here at North Shore, and we do have medical students and residents who come through and rotate, and a lot of them do spend some time with us here at the Cognitive and Behavioral Clinic. And you know, I try to teach them about all these things. And to my knowledge, people in this field are waking up to this whole concept of CTE and trying to pass that on to the next generation. So I think we're doing as best we can to try to educate them about it. And I've never gotten any pushback from them that they don't believe in it or they don't think there's a relationship. So I think they're very much aware of it.
I would agree with Jim that it's a process that'll take time, but the number of courses on CTE, the conferences on CTE, just like the publications on CTE, have kind of exploded in the last 5 years especially. So it's not going to be overnight that everybody understands things or brought up to the level, and certainly the majority will never be brought up to Jim's level. But the point is, the education is out there, it's ongoing, it'll take time to filter to greater numbers.
All right, a couple more questions. This one I think is an important one. Somebody said, I was diagnosed by my doctor with definitely having CTE. You guys said you can't definitively diagnose it. And what does that mean? How do we reconcile that?
Well, I'll be the bad guy and simply say, I would disagree with your doctor. I can't tell you whether you do or do not have CTE, but I can tell you that nobody right now can diagnose CTE in the living with certainty. We have high indexes of suspicion just based on the symptoms you have, the severity of the symptoms you have, the progression of the symptoms you have, the amount of exposure that you had to repetitive head trauma, but that still doesn't mean that we can be certain that you've got CTE if you're still living. It's a neuropathological diagnosis, period.
Jim, anything to add?
Yeah, you have to have a huge amount of humility in this field because oftentimes your clinical diagnosis won't match up with the autopsy diagnosis. You know, we really try to do the best we can. I'm sure his doctor means well, and they probably have their reasons for diagnosing it. But you know, just with any disease in neurodegenerative, in the whole neurodegenerative field, we really don't have a definitive way of diagnosing people in the living. We do have PET scanning in Alzheimer's disease and frontotemporal degeneration, but even those tests are not always accurate. And there's a huge number of patients who, you know, when you find out at autopsy, you find out, well, actually they had something a bit different, or they had a combination of different diseases. And it's very challenging. So you always give presumptive diagnosis to patients. And but I wouldn't be so hard on that doctor. I'm sure they're just doing their best, and probably the symptoms that the patient had, you know, matches up with what they think is most consistent with CTE.
Yeah, and then sometimes the word possible or probable can get dropped off in how we talk about it. So just know that anytime you're told you might have CT or TES is sometimes referred to the clinical syndrome, and we're getting more referring to the clinical syndrome as traumatic encephalopathy syndrome, is still a possible or probable in all cases.
Chris,
all right.
The one interjection I would want to make, and I'm not, I don't know this individual, and I'm certainly not saying this individual is one way or the other. We're getting just one side. But if that individual is telling this patient, you've got CTE, there's nothing we can do for you, and that's just it, goodbye, please get a second opinion from somebody that is more knowledgeable in the field.
Yeah, thank you. A couple more quick things, and I will give you guys final comments. Somebody asked me, now that I'm asked about pro wrestlers, do pro wrestlers get CTE? So the answer is yes. We actually diagnosed the first case in pro wrestling, Chris Benoit. Those of you who follow this know Vice TV did a really interesting couple-hour documentary on that. Just came out 2 weeks ago, so you can watch that. We recently diagnosed an old friend of mine, Matt Capitelli, with CTE, so it does happen in that too. Although he was also a football player, again, that cumulative concept. And then one piece of advice for parents, and I'll give you guys final comments. Somebody said, how do we deal with this with our kids? Should we be tracking their head impacts? Should we be just preventing their head impacts? What do you recommend with, you touched on this, Jim, but what do you recommend with kids right now? Bob, I'll let you start because you wrote a nice book about it.
Well, back in 2012, we wrote a book, Concussion in Our Kids, in which we suggested that kids should play flag football until high school, should not have heading in soccer until high school, and should avoid full contact checking in ice hockey until high school. And ice hockey's come up to age 13, and soccer's come up to no heading under the age of 10 in USA soccer, and limited heading 11 to 13. Football, flag football is now more popular for youth than is tackle football. So I think we want kids to be physically active. We should all be active our entire lives. It's very important to our physical and emotional health. But there are safer ways that you can be active playing football, for instance, than playing tackle football, namely playing flag football. And the same goes for rugby, touch rugby, or flag rugby, same idea.
Jim, anything to add? Is it basically just don't let kids get hit in the head if you don't have to?
Yeah, that's about right. I mean, I try not to be the guy who holds up the flag and walks around town and says you're doing bad things to your kids if you let them play football. But, if people ask me, I say, look, in my own case, I don't let my kid, I've got 3 boys, I don't let them near a football field. I just think that there's other things you could be doing with your time that are just as good for your cardiovascular system and good for teamwork. And, unfortunately, football is this wonderful game with, good teamwork. And, it's just it's an excellent game. When I played it, it has its role. But I think the realities now are that, you really, when you look at the game, I cringe when I watch all the head injuries. And if anyone asks me, I say, look, I wouldn't let my kids do it, and I don't let my own kids do it. So that's how I feel about it. And if I feel that way, I don't feel right about watching it either, because I don't feel like I should be watching something I wouldn't let my own kids do.
Right. And I think that's what you would let what you do to yourself is sort of a good question. I usually do that in my talks. And think about this if you're listening now. How many times have you been hit in the head hard in the last year? For me, it's 0. For most people, it's 0. And it's actually, I realize an indirect goal of mine every day is to never get hit in the head. And that's because I now know the value of my healthy brain. And if you're not out there banging your head every day, it's probably not a good idea to let your kid do it either. And if you are out there banging your head every day, I hope you're getting paid a lot of money because it's not worth it if you have a choice. And just for our military folks, I know some folks are here. We didn't touch on it in a big way, but we did launch Project Enlist in 2018 to really dig in on what's the difference with long-term effects with athletes versus military. We had about 50 veterans who donated in the first 10 years. We've now doubled that in the last 2. We're really excited to better understand the exposure to blast. Our folks who fought in Afghanistan and Iraq, OEF, OIF folks, our Vietnam veterans, our Korea veterans, we're getting a look at all of them. All of them had slightly different exposures. But that's a group we're really committed to learning more about and trying to help, especially with that interaction with PTSD. So if you want to sign up there, projectenlist.org is the place to go. So you guys have been awesome. I've kept you over because your answers are so good and these questions are so good. The whole group's still here. 95% of the people who started are still here. So thank you guys for being here. So final words, I'll start with you, Jim. Final message of hope and what to tell our folks that are at home worried about CTE.
Yeah, I guess my final message would be that in the neurodegenerative spectrum, at least in my experience, the CTE is probably the slowest progressive of all the diseases. And I think it's in many ways the most treatable. So try to be positive going into this, thinking, hey, look, I can tackle this problem. My family can do this together. We're all in it. We can improve.
Thank you. Bob?
Yeah, Bill, I agree 100% with what Jim just said. But building on the optimistic side of things, everything we're learning right now, at least where the knowledge stands today, it suggests that you've got to take more than 5 years of football to be at heightened risk for CTE and to be at very high risk over 14 and a half years. If those statistics hold up with future research, that certainly gives us great understanding that you probably can take 3,000, 4,000, 5,000 of these subconcussive hits without triggering significant increased risk of CTE in most individuals. And that's an awful lot of head trauma. So people who just played football through high school, kind of cool your jets about worrying about it. We can't say you don't have it, but the likelihood is not high.